Hello, lovely people. Good morning and welcome to I Live a Healthy Life. Today, like I said yesterday, we are going to talk about menstruation and all that you have to know about menses or menstruation. So we'll go straight to the point. Now, menstruation is basically the normal flow of blood through the vagina from the womb or the uterus. Now, just as everything has a beginning, has an end, menstruation also ceases, and that is what we call the menopausal stage. It means that menses has ceased, the person is not menstruating anymore. Now, and also when a lady is pregnant, this menses ceases, and some few months after or some years after delivery, the menses resumes. It doesn't just happen. The woman would have to ovulate, and ovulation is just a release of egg from the ovaries. And when it is released, it travels through the fallopian tube. And now, if there is no sperm, or if the person maybe had a protection, maybe family planning, or used condom, or person is abstaining. Now, because there was no sperm to fertilize this egg, it comes that it travels to the uterus, and then it's shed as blood, and then the person we say is menstruating. But then there are some signs that will let you, a young lady, know that you are ovulating. That is the change in body temperature. You become much warmer, and sometimes you feel some pain in your left or one side of the lower abdomen, and the breast become very, very heavy than usual. And sometimes, for those that are very observant, you could tell that the vaginal discharge is a bit stretchy when you use your hand to separate it. When you have some in your fingers and you want to separate it, it becomes a bit stretchy. Not too stretchy. Even though the discharge comes, if you see it to be very yellowish or has this awful scent, then you should know that there is an infection, so you need to see a doctor. Now, what girls usually have problems with is the menstrual cramps. What happens is that there's this hormones that we call prostaglandins, and these hormones are produced in the lining of the uterus, and this is what causes the muscles to contract. Now, the contractions can be compared to labor pains, so it means it's very, very painful. So we can use any of those over-the-counter drugs, the paracetamol, but then again, you shouldn't abuse it. When these pains become severe, then you have it in mind that there are other medical conditions that can bring these menstrual cramps. It's not just men's, but there are other medical conditions that can bring the cramps. Things like uterine fibroid, it can also cause it. Pelvic inflammatory disease, which is a sexually transmitted infection by bacteria. Yeah, you can also have the cramps when you have it, and also what we call the cervical stenosis, which means that the cells is very small, the opening is very small, and it limits the menstrual flow or the blood flowing, and hence the menstrual cramps. Now, let's move on to some of the treatment. You see, when it becomes severe like this, we can use one family planning device that we call the IUD, which is the intrauterine device. It's a very small, flexible, rod-like device that will be inserted in your uterus and can help the pain to be reduced. Okay, some other non-steroidal anti-inflammatory drugs can be used, like the ibuprofen and stuff, but it has to go with prescription, so you don't overtake it or overuse it. Now, in the house, there are some things that you can also use, like if you have a bathing tub, you can prepare a hot bath. You relax in it and help the blood to comes smoothly. And also you can put a heating pad there. That is if you have, but if you don't have, you can improvise it with a tip it in hot water or warm water. You squeeze the water out and apply it there gently, and this will melt the blood, comes smoothly. Then again, we have to be very, very careful as ladies to reduce our intake of fat, sugar, salt, caffeine, and all those things. There's also all these things also causes menstrual cramps, and we have to take more of fruits and vegetables. It will help us a lot. And also we should exercise. Usually athletes don't have this issue with menstrual cramps and all that, they don't, because they exercise a lot. So you have to be exercising regularly, and you also have to reduce stress. So that guys, please try not to stress your ladies when it's the time of the month. You have to reduce stress, and if you smoke, you have to quit it, because otherwise those menstrual cramps can never be ceased. Okay, so that's it. That's all that I have for you today. If a lady can menstruate, then it means that there should be something that we should talk about pets. And after we will talk about pregnancy, that is from conception to birth. I hope you enjoyed today's edition. I am still Dorcas. You can call